Welcome, everyone. My name is Gary Perkins, and I'm the Community Relations Advocate for the Family Life Center, the only dual certified crisis center in the county specializing in domestic abuse and sexual violence. Quick trigger warning, this episode of the Family Life Center Focus talks about Domestic Abuse Awareness Month. If you are a survivor, please take care of yourself. We want to make sure every listener is in a good mental state coming out of these discussions. Today's guest on the show is a special one. We met when I first started here at Family Life Center about a year ago, and we seem to cross paths often. We have a couple mutual friends. So I want everyone to welcome Dr. Laura McGuire. Hello, doctor. How are you today?
I'm good. How are you, Gary?
Good to see you. For those that are not familiar with who you are and the services you provide, can you kind of go down the list? I visited your website before this interview, I saw the list, and it's a lot, but it's all good information though.
Yeah, definitely. So I am fortunate. I run the National Center for Equity and Agency, which is a local consulting firm in Volusia and Flagler County. We service, though, organizations around the world, and our focus is sexual misconduct prevention and response, as well as diversity and inclusion. So we really look at both how violence comes up in communities and with individuals and how to address that, how to prevent that. And then we look at how marginalization and oppression, how being part of a community that is being erased or otherwise facing additional barriers increases risk of victimization and decreases comprehensive services. And so working to address all of those structural inequalities.
Awesome. And I know you're big into data as well. Just looking at the data, that's one way that you look at those, right? Awesome.
Yeah.
Well, we're glad to have you on this week's Family Life Center Focus. I wanted to take the time today and dig into Domestic Violence Awareness Month. I don't think a lot of people understand that October is Domestic Violence Awareness Month. It gets kind of pushed away. I believe it's one of those cancer awareness months. I'm not sure which one, but that gets a very, very big play, especially here in Flagler County. You are a Flagler County resident, correct?
I am, yeah.
So it's good to have somebody of your specialties actually living in our county, and I hope that our listeners enjoy what you have to say and also seek out your services and how they can help you. So National Domestic Violence Awareness Month is a time for domestic violence survivors and those who serve them to speak out in a unified voice to combat domestic violence and to challenge all people in America to support the countless programs that provide support and services to victims. The U.S. Department of Justice estimates that 1.3 million women and 835,000 men are victims of physical violence by partner every year. And according to the CDC, 1 in 4 women and 1 in 7 men will experience physical violence by their intimate partner at some point during their lives. Like I said, everyone should know that October is Domestic Violence Awareness Month. That's something that I'm trying to, just kind of push to the forefront. But why do you think it gets overlooked often?
Well, I think for a lot of people, this and April, which is Sexual Assault Awareness Month, they're kind of the most busy times of the year for me and professionals like myself. But for the general public, I mean, it's a really tough thing to talk about because it is complex, is nuanced. A lot of people, kind of feel uncomfortable around it more than, like you're saying, I think October is also Breast Cancer Awareness Month and some other awareness months. Like, it's almost easier to talk about an illness, a disease, than a social issue that kind of everyone has a part to play in. And a lot of people may have, mixed feelings about understanding the dynamics of. But I know for myself, like you said, I love data, and I am kind of in a unique space where I am both a survivor of domestic violence and a scholar. And I try to really blend those two things in talking about, yes, I have lived experience in this space, but then there's a ton of research behind how widespread this problem really is, that it's not, isolated to a particular community or age group or demographic. It's a problem across the board.
Definitely. And, especially living here in Flagler County and just talking to the community, A lot of people that I talk to, like, does it happen here? Domestic violence, sexual assault, like everyone is just kind of, they have a feeling that this is paradise, and, that type of stuff does not happen here in Flagler County. But if you look at the numbers, especially during COVID, you can see domestic violence, going up, sexual assault going up. So, you kind of mentioned, we often think about survivors we may know. I didn't know that you had a story as well. I look forward to hearing that one time or anytime that you're ready. But what about the marginalized and undocumented survivors? How do you think those two groups cope with Domestic Violence Awareness Month?
Yeah. So, I mean, when we talk about domestic violence, the most important thing I think is to kind of clarify what that is, right? That a lot of times, even in our field, that we'll have posters or billboards, all different kinds of campaigns on social media, and the only images we use are of usually a woman being hit by a man, and that's it. And so people think, oh, if it's not something that looks exactly like this,
Yeah.
then does it really count? And I know my personal story. I questioned that a lot. I was like, do I exactly fit this bill, this very limited narrative? And domestic violence can be so many things, right? It can be all kinds of physical violence. It can be all kinds of sexual violence, financial violence, spiritual,
Emotional.
right? It's huge. And so even if someone's saying, wow, someone's not beating me up, I don't have bruises on my eyes, they absolutely can be a survivor or in a dangerous situation. And so, and add on to that, being part of a marginalized community. For example, anyone who's an undocumented immigrant, they have a really hard time making sure that they find competent and comprehensive resources if they do want to come forward, right? Because there's that fear, is this going to be reported to someone? Could I, be deported on top of dealing with this violence? And then, like members of the LGBTQ community, which I'm also part of, we also face additional barriers because so many of these services are very gendered. I work a lot with male survivors too, right? And where do they often have to go is like a women's crisis center. Right. So there's, so many layers to this issue.
Yeah, is there, just in your travels and all your knowledge, is there a way that we can, because we want to make sure that we spread awareness by, commemorating Domestic Violence Awareness Month. But I often think about those two groups that we just kind of talked about, and does it make them feel bad? Is there ways that we can try to include them? Is there any type of, marketing that we can, just try to do to be proactive about domestic violence and really try to welcome them and let them know, hey, we're for you too. We don't discriminate here at the Family Life Center. We are very open, and we want to make sure that survivors have the help that they need.
Yeah. No, there's actually a ton people can do to make this a more inclusive conversation, even on the forefront of like visuals, right? What images we use, trying to think inclusively. Also, things that, like, I think one of your symbols is the butterfly, right? Like something
Right.
that's gender neutral, it's not triggering, trying to move away from, again, those kind of graphic, very stereotypical pictures. And, and make sure that when you're doing community education or when you're training staff, if you are even in the field, that you are having specific conversations with subject matter experts on these topics. So when I worked at the University of Houston or the U.S. Merchant Marine Academy, I would have special sessions on LGBTQ experiences, on working with male survivors. And a lot of times, that was the first time either of those institutions really had that.
Right.
It might be like a quick note in another conversation, but they hadn't had a whole, workshop dedicated just to those competencies. And that's really crucial.
Well, yeah, thank you. Thank you so much. And a side note, I just visited Houston for the first time. Beautiful city. Yeah, it was very, very interesting. I loved it. And that was with, the pandemic and stuff like that. Mm-hmm. So I can just imagine what it is opening up. So I just wanted to kind of throw that out there, but thank you so much. Some of the things that, people can our viewers can help out with and spreading awareness for Domestic Violence Awareness Month is share the phone number. Our phone number is listed right here. There you go. Sometimes being there for someone is as simple as sharing the resources necessary to help them. Our crisis helpline, 386-437-3505, and that's voice, TTY, TDD, and text. So we just added a texting capability. So what I've been telling, survivors is if you don't feel comfortable actually talking to someone, just, you can text. And I think that frees them up a little bit, and it's a lot easier. They're more willing to text than to talk, which is fine because we're fine as long as they're comfortable. Also, join us when we're in purple on Purple Thursday. So I want to invite you, Dr. Laura. Purple Thursday is going to be 10/29 this year. And Purple Thursday is a nationally recognized day where everyone is encouraged to wear purple to show support for victims of domestic violence and spread awareness about the cause. Start a social media campaign. You can tag us and use our hashtag Help Starts Here. Of course, we want to talk about, don't judge, just listen. And I think sometimes me personally, especially before I started working here, that was a problem of mine. I'm a problem solver, so I'm listening to problems and I'm trying to solve them. But at the same time, I've realized that, maybe they just wanted me to listen, and just to really just be there. And, I think it helps out our survivors as well. Get educated. I'm sure that's something that you can talk about a little bit more because you actually, have been through the schooling. And do you do any seminars or workshops or anything?
Yes, actually. So I write a lot on this topic for a number of publications and do a lot of speaking engagements. Really, that is the majority of what I do. I'm also a professor at Widener University and have some books coming out. But education that's engaging, that kind of blends the data, the research side with very practical applications. So
Right.
whenever I do a workshop or something, it's very focused on what are you going to do from here, not just here's some terrible stories and to make you feel sad and bad, but
Right.
so many trainings, they just kind of leave it there and they don't tell people what they can do. And there is a lot of people can do, like you're saying, learning what to say and what not to say, learning how to refer people to resources. But just the biggest thing is start by believing, start
Right.
by believing them. Don't immediately start questioning, are you sure? Or was it really that bad? That's
Mhm.
what so many survivors face. And it's kind of our worst nightmare.
Right.
And yeah, and I think being visible, like you're saying, posting hashtags and sharing stuff, people might think that's small, but survivors, we're always watching. And, sometimes people will say to me, oh, are these problems that big? And I tell them, whenever I go into a space, I can go into like a friend's cookout, their family cookout. Nobody knows me. And I'll say, oh, I work in sexual health education and I focus on violence prevention. And all these people will start coming up and saying, can I talk to you privately?
Right. Yeah. No,
Or
I know that feeling too.
it's all over. Yeah.
Yeah.
So
Everyone has a story. Everyone has a story, and I welcome, like you said, I'm sure, you just came there for a barbecue or a party, but, you definitely want to make sure that you're listening to anyone that feels comfortable. I think it's an honor for someone to feel comfortable telling their story, because that might be the first, that might be hopefully not the last time someone's told the story, but, that might be the first time. Another way to, of course, support Domestic Violence Awareness Month is support your local shelter. Family Life Center is the only dual certified center in the county. We have, right now, we have our Run Domestic Violence Out of Flagler County campaign going on where you pay $25 registration, you get event t-shirt, and you're really supposed to either run a 5K or walk a 3K, but it's over a month span. So you don't have to, just do it all at once on a Saturday morning. So that's definitely a way. And then we have our no-show gala. We have Giving Tuesday coming up next month. I can't believe it's the end of the year already. So that's pretty interesting. Well, thank you so much, Dr. Laura. I want to, thank you for joining us today. Can you tell our viewers how they can get in touch with you if they have any questions?
Sure, absolutely. So you can easily find me personally at drdrlauramaguire.com or at my organization at equityandagency.com. You can find me on LinkedIn. I'm always on there, or Instagram at Dr. Laura McGuire.
How about coffee shops? You frequent local coffee shops?
Yes, you can probably find me in Spiller Bees. We're carrying out like
Awesome, awesome. Well, this won't be the last time we'll be speaking with Dr. Laura. Next time, we're going to dive into a discussion about consent, which is kind of like your specialty, right?
Yeah, that's
Okay.
most of my work.
I think that one will have to be a two-parter because I believe that topic is going to be very, very important, but also it's going to be very, very educational to our viewers. Just a couple of reminders. I did mention, the Run Domestic Violence Out of Flagler County event. You can still sign up on our Eventbrite. But also just to mention that we did add the texting feature to the app. So that anybody that is in a crisis or anybody that wants to talk, they can actually contact us at 386-437-3505. If you have any other questions, feel free to visit our website, familylifecenterflagler.org. Make sure you follow us on Facebook, Instagram. We actually just created a TikTok too. We have a new youth advocate. So we're just trying to reach everyone that we can. I think that's the most important thing, and letting people understand or letting people know that our services are free and confidential, and just spread awareness. I think us at the Family Life Center and you, Dr. Laura, we do such an important job, and for us to be able to come together for the cause is a remarkable thing, and I look forward to working with you in the future.
Definitely. Right. Thank you so much.
All right. Bye, Dr. Laura. Thank you so much. Bye, guys.